So good morning or afternoon or whatever time it happens to be when you're listening to this. I wanted to give you some additional tips today for self-care for allergies, some different acupuncture and acupressure points you can use. Obviously not be needling yourself, but some acupressure points that you can use that you can massage on your own to help you get the relief that you need if you have an allergy attack that's going on in the middle of the day and you're not quite sure about, don't have any medication or anything else to take with you to handle it, and you just need something to just take the edge off a little bit. So we're going to cover a few points today. We're going to start from the top of the head down. Most of these are on the head and face to deal with immediate symptoms. The first two today that we're going to look at are meant for runny nose or copious drainage, postnasal drip, that kind of thing. The first one is called governing vessel 23. It's about half a thumb width, half an inch above the hairline. So if you don't have any hair and need to know where that is, one palm right above the eyebrows, and then a little bit further up right here is the point to press. Little clockwise motion, little counterclockwise motion. Hold it 5 to 10 seconds, give a little vibration, that kind of action. That's the kind of stimulation you want to do on these points for all of these today. So this one here is good, runny noses, postnasal drip, that kind of action. The second one is actually the third eye point, yin tong is the name. Also has the same effect here, right between the eyebrows and a little above it as well. Okay, the next couple that we want to work on are for red eyes, itchy eyes. One of them is bladder 2, so if you find the inside corner of the eye here and go straight up right over the eyebrows to this point here on either side. It should be right on the inside edge of the eyebrows. This is bladder 2 here. This is helpful. Red eyes, itchy eyes, also to massage out and across the eyebrows this way here, or to stay in the little divot in between the inside of the eye and right above it. There's this little divot that you can kind of feel. Obviously don't poke your own eye, but just a little bit of pressure up and in can be very helpful. Also good for eye strain, incidentally, but that's not a focus of what we're talking about today. So this is bladder 1, this is bladder 2, and across the eyebrow. That's not a point in specific, there are a few that you hit in that area. The next one is stomach 2, so if you find where your pupils are and go down over the ridge of the eye socket, you're going to fall into a little divot here. Good. Some sinus headaches, not all of them, but some of them. A bit of frontal sinus pressure. Again, red eyes, itchy eyes, that kind of situation. Also good for allergies that present also with sinus congestion or copious mucus discharge, that kind of thing. Right in here in this little divot. All right, and then large intestine 20. If you follow the curve of the nose and mouth at the level of the bottom of the nostril, the ala nasi is what it's called. The level of the bottom of the nostril here, you're going to fall into another little divot here, and this point is pressed up and in this way toward the nose, or down and out in this direction, and this point specifically is meant to help open the nasal passages. If you're going to work these points again, clockwise motion, counterclockwise motion, press and vibrate a little bit, or a bit of a rubbing action this direction, rather than scratching your nose, scratching your eyes or your eyelids, or doing something that sort of aggravates the symptom that you need, like you feel if you rub your eyes once, then you got to rub it, for the next 5, 10, 15 seconds, something like that. A firm pressure or a very specifically placed pressure on the face and head can help alleviate the symptom without giving you that kind of effect. The last two I want to talk about today are actually on the arm. One is lung 7. So I have to turn a little bit so you can see the point. But here, on this side of the arm by the thumb, if you find the little crease made by two tendons here and roll over. There's a bone protrusion here, roll over, and into, again, a little divot. This is often tender to palpate, even if you're not having allergy symptoms. This is lung 7, also very good for helping with head, face stuff in general rather than any kind of symptom in specific. And then also is large intestine 4. This is a common point that you can look up in other places online as well. This is good for sinus headaches and other headache pressure, specifically here in this region that's nose or below, sometimes frontal sinuses as well. Incidentally, large intestine 4, this point here again, is useful. While useful for headaches, it's not useful for all kinds of headaches, which is typically said to be. So you'll have to try it out for whichever kind of headache you have and see if that's effective for you, or come see me and I can let you know in advance. And these points, again, these points on the arm, these are on both sides of both arms, so you can use them on both sides of the body. It doesn't have to be the left side or the right side, something like that. So these are some points that you can use to help alleviate some allergy symptoms. If you're in the midst of an allergy attack, don't have anything to take, don't have any other kind of approaches, and just happen to be caught up in the middle of something unawares. Also, again, check out our other posts. We talk about acupuncture treatment for allergies, herbal medicine treatment for allergies. You can see some of the formulas on the shelf behind me, some of which we do use very well for allergies, and also dietary care to help you reduce allergy symptoms by taking better control of your diet and what you eat on a regular basis. So I hope you find this helpful, and yeah, go out and enjoy the spring. Take care.